Precision Opinions Live with Christian Stella, and I'm here with Himani Sundri, and she is a candidate 2021 Pharm D, goes to St. John's University, right now works part-time at CVS, and she's doing her rotation at Precision Compounding Pharmacy. Very intelligent student and interested in a lot of different topics, but one that we've been working with a lot recently, and some months, sometimes we get different waves. The wave of what we got this month had to do with bacterial vaginosis. So we're going to talk a little bit about that. Bacterial vaginosis, what is it?
Okay, so bacterial vaginosis is when you have an abnormal amount of bad bacteria in your vagina versus good bacteria. So that throws off your whole balance and affects your pH levels. So it's basically an infection, a bacterial infection.
Okay, and that can move around. The bacteria can go up. It can be low. We need good bacteria. We don't want bad bacteria, and we need to eradicate that bad bacteria.
Mm-hmm.
We deal with a lot of medication when it comes down to BV, and a lot of medication when it comes down to yeast too. But one of first line, right?
Mm-hmm. Yeah.
One of the greatest medications for BV is metronidazole. Can you go into that a little bit?
Yeah, so there's different formulations of metronidazole. So it comes in a tablet form, and it's also called Metrogel, which is a gel you can insert vaginally. It's like a 5-day course. So based on if you're pregnant or not, if you only really have the option if you're pregnant to just take the oral tablet, but if you're not pregnant, you also have the option, if you prefer a gel, and then you can take the tablet as well.
Okay. So that's available over the counter. So you can walk into a CVS, Walgreens, and just grab that, which is great. But there could be some issues with that when it comes down to patients just grabbing it whenever they need it. It's not prescribed, but it works good, and it's first line. Pretty much can kill the bacterial infection.
Right.
We do work with another one, which is nystatin. And nystatin, what is that?
So that's an antifungal, and it's actually an important aspect when women take antibiotics, because when women are taking antibiotics, an antibiotic, it's not selective, so it kills off all good bacteria and bad bacteria. So when you have a clean slate of no bacteria there, you're predisposed to yeast infections. So once you add an antifungal like nystatin, it's gonna help compensate for the missing bacteria, so that way the yeast doesn't overproduce and you don't have an excess amount. And when you have BV, a common side effect is you are constantly itching. It's like a vaginal irritation. So when you're applying an antifungal, it also helps release some of that also.
Exactly. That's exactly what you said is perfect. We've been making a lot of metronidazole and nystatin combination, and that's the exact reason. So when you use a heavy antibiotic like metronidazole, it can wipe out the good flora, and the good flora includes yeast as well. So it's bacteria and yeast. That metronidazole can wipe out all of it. Exactly. So what we do is we add a little nystatin to protect from any sort of yeast infections. So this is actually, and when we were looking this up, we saw it's available in Canada.
Yeah.
But not here.
Right.
So we can make it at a compounding pharmacy because we're going off label.
Yeah.
And what we do is we'll make it into a suppository. How do we make those? What do we do?
So you have a suppository base, which you heat up and it melts, and then you add your active ingredients. So in this case, it would be metronidazole and nystatin. And then once those are hardened, you would put them in a freezer, and so they get solidified. And then once they are solidified, they are then closed, so you can insert them.
Sealed.
Yeah,
yep.
Sealed. Yep.
Okay. They come in like a little plastic insert. And I like to explain to patients they're peeling it like a banana, just peeling it off, and then they'll insert it about half a fingernail's length vaginally, and it takes about 20 minutes for them to absorb. They keep it in the refrigerator. They can take it out and let it get a little warm on the warmer side.
Yeah.
So when they insert, it's not so chilly.
Yeah.
All right. But thank you for coming on. You were fantastic.
Thank you.
And you're going to have a beautiful career in the future.
Thank you so much.
All right.